class. I wanted to give you an example of what the expert group presentation is going to be like with an example here. But I also want to walk you through kind of like what type of things to expect and what type of things that you can do. So this should be available to you on the course website. So just so you know that this will be available. So I'm going to do an example here about specific phobia. Since we've all watched the case of Rita, I thought this would be just a good one to start off with, since you already have a lot of really good information about this case, and we can just kind of focus more on what's the content of this. So I decided that I'm going to do this through PowerPoint, or I guess this is Google Slides. You can choose whatever form that you want to do this with, but this is a good way to do this. So as a reminder, your expert group has two parts to it. The first part is a infographic. So some sort of beautifully designed things. So for example, my infographic here about specific phobia, I have some fast facts here about the key symptoms, some risk factors, treatments, so this is the type of information that you're going to see. And then I have something about the onset and prevalence, and then I have something about a first person account. I have my references down here at the bottom. One of the things that I want you to do when you're first starting your presentation is to talk a little bit about what's on your handout. So this is just giving some background information about the specific phobia, and some of that information, I wrote down where it came from, which is down here. But so, just to kind of like couch this in, what are we going to be talking about? So today I'm going to tell you about a case study about specific phobia, key symptoms, irrational fear of a particular object or situation. This is common, relatively common. 9% of adults will have this within the last year. And it seems to be more common in females than males. Some things that can make you more likely to have specific phobia is some sort of traumatic event. So if that is, being attacked by a dog, that might make you afraid of dogs. Having a negative temperament, so, maybe being that difficult baby, and kind of having that kind of temperament, which is like an early personality. How we treat this is typically with something called exposure therapy, where we expose somebody to their traumatic, or to their phobia, sorry, not trauma, where we expose somebody to their phobia, or we do cognitive behavioral therapy, which is part of that exposure, but also targeting some of those thoughts. So just as kind of an analysis, some parts of this speech was not so great because I was just reading off the slide. So one of the things that is good to do when you are talking about a slide is to not read off of it. The less words, the better. Bullet points could actually make this a little bit easier to read. So, one of the things I might want to do is actually increase my bullet points and the spaces between them. So that might be something that'll just make it a little bit easier to see. I can bold some stuff, those types of things. So again, first things, just kind of tell a little bit about what your what the disorder is that you're going to be talking about. Next, we want to get into the case study. So here's where I'm going to provide some information about the presenting problem. So why was Rita coming in to the clinic? What type of symptoms was she starting to show? And I wanted to, kind of do a little analysis here and kind of think about the 4Ds. So you are allowed to show a video. I'm not going to show a video because we watched it already in class, but this is supposed to be a 10-minute talk, and it might help to actually see a video of what the patient is going through, or having students kind of read beforehand what the case study is about. so that we, kind of have like a discussion about it. So if you have a 2 to 3 minute video, you can definitely show that. Maybe 5 minutes is like the max. So that this can now make it a lot easier to understand how this case study reflects what you're going to be talking about, which is the disorder. So I am talking about, the presenting problem here. She's coming to the clinic for fear of birds. She's showing this by she's not sitting outside, she's not looking at birds, she's staying in a tent on the holiday. So she's really having a hard time enjoying herself. And that gets me down to the 4 Ds. 2 of them that I think I see here is distress. Even in the first, day of therapy, she has a lot of anxiety, even, thinking about a bird and then looking at a picture of a bird. So that distress is really high. And she says that like this is making her not be able to do things like go out and shop or go on a holiday. And so that is distressing to her that these symptoms are interfering with her life. And so that interference is something that we call dysfunction. She really can't enjoy her holiday time. But one of the interesting things is that she was still able to go to work. So she wasn't having dysfunction in all areas of her life. It just seemed like it was in her enjoyment time. So one of the big things that I want you to do is an analysis. So you can analyze this case in multiple ways. I'm going to show you a couple of ways that you can do this. You don't have to hit every point. That's really important to know. So for example, you might not have a clinician actually doing anything, right? This one with Rita actually does have a therapist is doing something, so I can kind of figure out what the assessment is. So that's important to note, right? So I can kind of assess what's happening in the room. So she does have a therapist with her. You might not have a therapist, so that's okay. And I'm analyzing this because we talked about interviewing. So this seemed to be an unstructured interview. He asked questions, but was also really flexible. So he asked her like a question about what was going on, when she was experiencing the jackdaw, and he stopped and he paused and he's like, "You look really distressed right now." And she, stopped and cried about it. But that shows that it was relatively unstructured, right? That's not usually what we talk. If it was a very structured thing, we probably wouldn't go there. Something else that you can assess is the biopsychosocial aspects of the case. So what might be creating this disorder or maintaining the disorder. So that should be something that you can do probably with a lot of your cases. They'll probably talk about their history with it. They'll probably talk about like what was going on. They might allude or tell you about thoughts that they had. So always think about the cognitive, so what are they telling you about their thoughts or beliefs? So like wanting to be in control was something that Rita mentioned. That's really important for us to kind of go like, oh, so her not being in control might lead her to be more anxious than usual, right? And she can't control the birds and what they do. Look for behavioral things. So if somebody is escaping or avoiding something, that's often a behavioral issue. So we can think about that as operant conditioning, and that reinforces that anxiety. You can think about social things like traumas, how they were raised, whether or not socioeconomic status might be involved, all of those things. Biological might be harder, but, you can always think about family history. Not sure if there's any medical conditions going on for Rita, for example. So even if you don't have complete information, you can still do this analysis. You can also do an analysis of a diagnosis. So here I know exactly what diagnosis that she has, and what I did is I went to the DSM-5. You can look that up in your library and see if you can find all of the information about these about this specific disorder. So here I have the criteria, and then I say how it's met. I didn't have all of the criteria, but it seemed like she met all criteria. So you can kind of pick and choose if necessary. But how does she meet that criteria? Another thing you can do is think about whether or not there was a differential diagnosis. Was there something that we should be considering as a secondary diagnosis, or maybe one that better explains it than, in Rita's case, a specific phobia? But one of the things that was really hard about Rita's case, yeah, she was diagnosed with specific phobia, but we also don't know how much this might be, actual PTSD, for example. So that's an open question that I really had at the end of this. That might be something to ask the audience. Well, what do you think? Since we all just watched the video of Rita, what do you think? Do you think she was traumatized by her past? What type of things might we need to know about with PTSD to see if she has it? One of the last things you can analyze, you can analyze anything, right? But is treatment. So what type of treatment was done, or what type of treatment would you do with that particular case? So you might do some research outside of class and see whether or not you can find, what is the most effective treatment for specific phobia in this case, or for schizophrenia, whatever you have. Since I already know what she completed, I just said this is how she completed cognitive behavioral therapy. They created this fear hierarchy where at first she was just talking about birds and she was really distressed. Then she learned about relaxation, and then she saw the pictures of the bird and eventually touched a feather, and eventually went outside to feed him. And then we saw her at the end of the video actually touching birds, and stroking birds, like petting them, right? That was pretty amazing. So, one of the things that she did really was being exposed to the fears. And she also rated how anxious she was. So at first she was very anxious, and by the end she really didn't seem very anxious at all. Again, I have my citation down here, so do cite where you're getting these different things. I just have an overall conclusion, like what should we make of this? I thought it was a very nice example of a specific phobia and its treatment, because we got to see both what symptoms she was showing, but also how quickly it turned around. Another thing I noticed was that the therapist had a good therapeutic alliance with Rita, so that might be something to cover. And it was a good success story because she was able to get over her phobia, calling it the best thing that has ever happened to her. Last but not least, I have my references. So this is an example, perfectly fine example. Obviously, I did a lot of talking through this, commenting it out, what would I do? But this is just one way to kind of make sure. This is just one way to actually present this. If you want to use Prezi, if you want to use anything else, you can. You don't have to use just a slideshow. If instead you wanted to do this without notes on the screen, you can definitely do that. Whatever works best for you. So I think that's all I had. So your main goals: 1, tell them about the disorder. 2, talk about a case study. And 3, analyze that case study based on information about the disorder, based on what things that you're recognizing in class, assessment, diagnosis, and treatment, for example. All right, let me know if you have any questions. Bye.